Hello. All right. Okay. So this is over prosthetic designs for clefts of the secondary palate, their effectiveness, benefits, and their limitations. So a cleft prosthesis is a maxillofacial prosthetic. They're all designed to kind of close the cleft, um, the hole that was caused by the cleft, in order to improve feeding, swallowing, speech, or all of the above. So these are generally made by maxillofacial prosthetists or prosthodontists. It, of course, is an interdisciplinary team. So along with those, the creators of the prostheses, comes, orthodontists, dentists, primary care physicians, and of course, SLPs, along with many more. So the differences in all of these prosthetics kind of lies within the structure and kind of the timing of the use. So whether that be pre-op, post-op, and depending on if it's kind of aiming towards fixing the feeding and swallowing or the speech aspect, or both. So the first one I'm going to talk about is the palatal obturator, which is a plastic impression compound made by a mold of the oral cavity. They have a feeding obturator, which improves the infant's suction during feeding. So this is a pre-op device or prosthetic. So it forms kind of a vacuum seal on the infant's palate that helps with suction and decreases nasal regurgitation. And it also allows for that typical suction breathing pattern as well while the infant is feeding. So speech obturator improves speech, and by helping that VP meet full closure, being sufficient closure, to reduce nasal emissions and nasality of the speech. So some cons with all of these prosthetics that I want to talk about is that it's uncomfortable while wearing, or it can be, and while adjusting to it as well. The maintenance in terms of cleaning it. There's limited aesthetic improvement in terms of like facial symmetry, things like that, when compared to surgical intervention. There's risk for oral irritation. It's a temporary fix, and they're all fairly expensive as well. So this next one is a palatal lift prosthesis. This helps with VP port insufficiency. What's interesting about this is not only can it be used with clefts, it can be used for patients that have had neurological events like strokes to kind of help with that VP port insufficiency as well. So this one physically lifts the palate to meet full closure with a raised portion of the prosthetic to physically lift it. And again, it's a plastic impression that's made from a mold of the oral cavity. So some cons of this are the size of the device. Because it kind of juts out to lift the palate, it's pretty large, so that can kind of impact articulation. So while it doesn't help with that nasality of speech, it can cause articulation difficulties, so with other sounds, just because of the size, and that can also impact feeding and swallowing as well. Again, some discomfort, the maintenance, cost, the aesthetics, and the temporary solution that it is. Next is a speech bulb. It's speech-based, like it says in the name. Again, helps with velopharyngeal insufficiency due to unsuccessful surgical interventions, so post-op. It closes the space between the secondary palate and the posterior pharyngeal wall, kind of helping it get full closure of that VP port to improve nasal emissions and nasality of speech. Again, it's usually post-op, so usually for patients of at least 5 years of age. And again, it's a palatal measurement made of plastic used from a mold of the oral cavity. So some cons, it can be difficult to eat and drink, some discomfort, some maintenance, fit changes, cost, aesthetics, and the stigma just of having this prosthetic in order to produce typical speech. This last one is an interim prosthesis. This one is usually pre-op, so before surgical intervention. It can be post-op, but typically pre-op. It helps with speech and swallowing, and it's kind of used as an option mainly if someone has surgery planned for the future, but they're just kind of waiting a specific surgeon or they're just not quite ready for it. They'll give them this prosthetic that is kind of more known as the temporary fix, even though they all are temporary fixes. What's interesting about this is that this can kind of help the aesthetics of a cleft because it can help conceal the cleft because it's smooth, because it's made of wax. So it kind of forms to the rest of your palate and your oral cavity a lot more cohesively. So with that, it can improve lip closure and facial symmetry. So some cons, just like the rest, decreased functionality as the patient grows. You're going to have to get it multiple fits as your mouth is growing. Some discomfort, maintenance, fit changes, cost, and the stigma. So these are my references. Most of these are pretty biased in that they all kind of state the obvious in terms of stating, these prosthetics are great and they're wonderful and everyone with a cleft palate should use these. But it doesn't really dive into the fact that there are, constraints for certain individuals to be able to use this, such as the cons I mentioned, just cost, accessibility, things like that. So there are some constraints, but overall, these references did a nice job at, stating what the device does, kind of hitting home on those interdisciplinary practices, and then also kind of, mentioning how this in combination with speech therapy can really kind of impact one's speech. So some questions I would like to know for myself are more of the differences within these prosthetics. I feel like it's kind of confusing. So I feel like I would like to know, when a prosthodontist or someone would choose one device over the next. Obviously, with like if it's more speech based versus swallowing, like that's understandable. But if you're looking at a speech bulb versus an interim prostheses, so that's kind of a question I still have. In terms of clinical practice, I'm sure many of you know that I have a really strong interest in working with cleft palates. I got to shadow Children's Hospital in their cleft palate clinic, which was really interesting. And so I think having some knowledge of these different prosthetics and what I might be looking for in terms of recommendations or just speech therapy in general, I think that's pretty clinically relevant. So if you have any questions about this presentation, leave them in a comment below. All right. Thank you.